Welcome to On Call Medical Radio, a production of the Healing Words Foundation. Here with today's guest is On Call Medical Editor, Dr. Rick Holm.
We're here talking with Dr. Christina Hill Jensen, a gastroenterologist from Sioux Falls, and Dr. Mike Bauer, a general surgeon from Sioux Falls, about abdominal pain and abdominal problems, and specifically colon cancer. Christina, tell me about how to screen for colon cancer.
Well, we recommend screening it starting at age 50 and it's with a colonoscopy, a long flexible tube that goes through the rectum and examines all of the colon. The patient is asleep and comfortable. The procedure usually takes less than 20 minutes, and the worst part is going to be the preparation, the bowel cleanse.
And how about the yearly rectal exam and hemocoat slide?
Yep, those are also very important, doing that. And there are other alternatives, a CT colonography, barium enema, flexible sigmoidoscopy. But still, we support the colonoscopy as a preferred method.
Right, if you do the other tests and you find that there's something, then you need to go after it with a colonoscopy.
Absolutely.
Mike, what about when abnormalities are found with that colonoscopy? What is your comments about those?
Well, typically, a lot of these polyps can be removed with the scope itself. And as you know, colon cancers, we kind of know the progression of colon cancer. They start as polyps and generally progress into cancer. Not all polyps, but there are certain types of polyps that turn into cancer. So if you can get rid of those polyps, you basically try to eliminate your chances for cancer. Sometimes these polyps are too big and they can't be removed, or we find a cancer actually during the scope, then typically surgical intervention is recommended at that point.
And what kind of intervention?
And typically we try to do most surgery today laparoscopically, and people tolerate it very well. We can basically get the portion of the colon out, any portion of the colon out, usually with a couple working ports and a small camera.
So much less invasive than before. Well, we'll be back in just a minute.
Watch On Call. Physicians from around the state using science-based, reliable medical information to answer your questions live. Thursday nights at 7 Central, 6 Mountain on South Dakota Public Broadcasting.
We're back talking with Dr. Christina Hill Jensen and Mike Bauer of Sioux Falls about stomach or colon cancer. Christina, take-home messages?
Change in bowel movements, blood in the stool. Go be evaluated immediately. This is serious.
All right. And Mike?
Colon cancer is preventable, and if you do your screening, this is one of the cancers that we know how to prevent, and it's not. Although there's most other ones we can't yet, but this is one that we have a good chance of preventing this from happening. So get your colonoscopy done, and it's not fun, and no one likes to do it, but it could be life-saving.
Well, thank you both for joining us.
You're welcome.
And until next time, stay healthy out there, people.
You've been listening to On Call Medical Radio. On Call is produced by the Healing Words Foundation and made possible in part by the South Dakota Foundation for Medical Care. The foundation strongly urges all of us to remember immunizations this season. Pneumonia and flu shots save lives.